Hello, I'm Dr. Patrick Hwu, Chair of the Melanoma Medical Oncology Department at MD Anderson Cancer Center. Today I'm going to talk to you about our T-cell therapy program. Melanoma is a disease that starts on the skin. When it's caught early, it can be cut out. But the danger is that it can spread to all parts of the body. When that happens, it's challenging to treat. There are a number of approaches to treat metastatic melanoma, including targeted therapies and immunotherapies. Today we're going to talk about one of these immunotherapies called T-cell therapy. A T-cell is a kind of immune cell that is capable of recognizing and killing tumor cells directly. The T-cells recognize the tumor and touch the tumor and release proteins that cause the tumor to die. Our goal is to give these T-cells to patients to try to kill their cancer. In every melanoma, there are immune cells called T-cells that are there trying to kill the tumor, but obviously they're not doing a good enough job because the tumor is growing. We've learned to cut out these tumors, take them to our laboratory, and grow up the immune cells and induce their proliferation to billions that we can then infuse back into the patient to try to eliminate their cancer. We can't grow these T cells on every patient. T cells grow in about 50 to 60% of the time. It's important to try to get these tumors prior to the patient getting any chemotherapy because the chemotherapy can kill the T cells. We're working hard in the laboratory to try to figure out how to grow these T cells in a larger number of patients. But when we can grow these T cells and we reinfuse them into the patients, we found so far that the tumors shrink about 50% of the time. Many of these responses are highly durable, lasting months to years. We're working very hard in the laboratory and in the clinic to try to improve these treatments by putting in different genes into the T cells, for example, or combining the therapies with additional immune stimulants. To be eligible to receive these therapies, first of all, you need to have a tumor that we can resect in the operating room or in the clinic. That's because that's where we get the T cells from the tumor. Secondly, we'll do a number of tests to make sure that the therapy is safe to give, such as a test of the heart and a test of the lungs. Some of the side effects are largely caused by the interleukin-2 that we give along with the T cells. This is a growth factor for the T cells, but it can cause low blood pressure, fluid on the lungs, and other side effects. Therefore, we're going to test your heart and lungs to make sure it's safe to give you. If you're interested in being considered for these treatments, please call us at MD Anderson Cancer Center.